Hi, my name is Bob, and I'm here to let you know what to expect when you come to Memorial Hospital Pembroke. We want to make sure you have all the information you need to feel comfortable and to prepare for your procedure. First of all, we want to make sure that you arrive here and return home safely. If you are visiting us for a procedure requiring any type of anesthesia, taken either by mouth or intravenously, an adult driver will need to take you home after your procedure. If you don't have a driver committed to taking you home, your procedure will be canceled and rescheduled for a different date. If you have any questions about whether your procedure will use anesthesia, please call the pre-admitting nurse at 954-883-8029. When you arrive at Memorial Hospital Pembroke on the day of your procedure, please park in the outpatient entrance. We're happy to offer you free valet parking from 8 o'clock a.m. to 6 o'clock p.m. If you are arriving before 8 o'clock a.m., please park in the outpatient parking lot located directly next to the outpatient entrance on the south side of the building. That way, you'll be conveniently located when you are discharged. When you enter the building, you will register at the front registration desk. All of your visitors will need to register with security and receive a visitor pass. In order to register, they will need a picture identification card. Then, depending on your procedure's scheduled time, you will either be taken to the pre-procedural department or you will be asked to take a seat until the nurse calls your name. While you are here, you will probably notice that you will be asked the same questions about your medical history, your name, and what procedure you will schedule for by various members of the team caring for you. Our team repeats these questions on purpose to ensure your safety. Once you are in the pre-procedure department, you will be asked to change into hospital attire if your procedure requires it. Your clothes and belongings will be placed in a personal belongings bag and kept in a locker. Some patients will not need to change their clothing depending on their procedure. Once you have changed, the nurse will prepare you for your procedure by starting an intravenous line, drawing blood, or completing any last-minute tests. If your procedure requires anesthesia, you will be assessed and interviewed by a member of the anesthesia team to determine the safest method of anesthetics for you. Be prepared for the anesthesiologist to cover your entire medical history with you. If you have a surgery site where an incision will be made, the nurse will ask you to verify it. Once you have verified your site and all paperwork is confirmed, the nurse will mark your surgery site with the word yes. This mark will be directly placed on your skin with a sterile marker close to the incision site. Close to the scheduled time of your procedure, the surgeon or physician performing your procedure will visit you in the pre-procedure department. If you have a surgery site, your surgeon or physician will verify the site with you, confirm all paperwork, and mark your site with his or her initials. This mark will be directly placed on your skin with a sterile marker close to the yes. Next, you will be asked to sign consent forms. While in the pre-procedure department, the nurses who will care for you during your procedure will introduce themselves, verify your armband, and ask a variety of questions you have already answered when talking to the other team members. Remember, this repetition is for your safety. Once you are fully prepared, your nurse and other members of the team who will assist the surgeon or physician during your procedure will take you to the procedure room. Your family and friends will be escorted to the family waiting room where they will be updated as to your progress by the receptionist and by Memorial Hospital Pembroke's patient tracking system. The surgical services waiting room also has food, drinks, and amenities that will help your family pass the time during your procedure. When your procedure is completed, you will be transported to the appropriate level of recovery depending on your procedure. Your surgeon or physician will speak directly with your family and friends in the family waiting room. Please discuss with your surgeon or physician prior to your procedure if there is anything you would like to keep confidential. If you are going home the same day and you need recovery from anesthetics, you will be transferred to Phase 1 recovery. There, experienced nurses will care for you while you are waking up from the anesthetics. Once you are alert, you will be transferred to Phase 2 recovery. If you do not need recovery from anesthetics, you will be transported straight to Phase 2 recovery or outpatient recovery in preparation for discharge. In Phase 2 recovery, you will be given something to eat and required to urinate prior to being discharged. You will be provided with discharge instructions as to your activity level and diet. Prior to leaving, your discharging nurse will verify with you the appropriate phone number where you can be reached the next day. Please provide a reliable phone number for a follow-up phone call. If you are staying at Memorial Hospital Pembroke, you will be transferred to Phase 1 recovery once your procedure is completed. There, experienced nurses will care for you while you are waking up from the anesthetics. Once you are alert, you will be transported to your inpatient room and introduced to the nurse who will be caring for you.